Hi, everybody. Welcome to the Hope Dealer Podcast with Dr. Brian Hooten here in Dallas, Texas. We won a great award yesterday. We became Aiden Barrera's favorite chiropractor ever. So we got this big plaque back there. It was awesome. And he celebrated with a giant poop. As funny as that is, he's been constipated. He gets adjusted and his body starts to work and he can poop again. In this video, we're not going to talk all about poop. We are going to talk about exercise, some diet strategies. In fact, I'm going to break that up into two parts. So today we're going to just go into the diet, and in the next video we'll go into the exercise part. So whether you're a beginner with your eating habits, like let's say you just eat fast food, you haven't really paid attention to what you're putting in your body and you know you need to change it, whether you're a beginner or you're a crafty veteran, you've been down this road for a while, odds are you're going to learn something from this video. I learn stuff every day. So I'm going to break down the basics and give you some simple rules to follow if you know you need to change what you're eating. And more importantly, there's one big step that most people completely forget. So I was a sick baby, just not quite like Aiden was, where I couldn't poop, but my lungs weren't working. My body was malfunctioning. I was sick all the time. And if I didn't take this medication, this cocktail of pills every morning and night, I would wind up getting pneumonia. I would have to go to the pediatrician and do a steroid breathing treatment. Back in the 70s, they called it the bird machine. And this was my life from as early as I can remember, 4 and 5 years old, all the way up to 13. My parents said, before I was 2, I had been in the hospital 15 to 20 times. So I was a real sick baby. And maybe some of you have a sick child, or maybe you yourself are dealing with some type of diagnosis or disease. In my case, the disease was called Goodpasture syndrome. You can look that up if you want to, but basically it's a genetic condition. That's what the doctor said. It's incurable. I was so severe that I wasn't projected to live past 40. And this was all laid out for me, as a kid, when all I cared about was chasing girls and playing soccer. Well, my kidneys started to have trouble, and that was the first pain I ever had. Well, just to back up a little bit, and this is where I want to get into the first step. So maybe you're trying to lose weight, maybe you're trying to conquer a disease. Like I said, we are going to get into nutrition, I promise, because that was a big part of my journey. But this first thing is always first. Actually, there's really two things, so I didn't mean to lie to you there. We got 3 things to cover. So you got nutrition will be third. Number 1 is our mindsets. We had been stuck in the doctors thinking that I was going to be sick for the rest of my life, and going to get these lung x-rays all the time. So when I would get pneumonia, I was in the hospital, and they would x-ray my lungs and tell me how bad the pneumonia was. Well, every time they did that, you could see my spine on the x-rays, and my spine was crooked to the tune of like 48 degrees. So it wasn't a small curvature, it was 18 and 30. And this was right there in front of us, right there in front of the doctors. And the doctors and all of their loving care that they had for me never said a word about it because they don't think there's a real cause to things. They think it's genetics or they think it's bad luck. So nobody said anything about my spinal health. So there's 2 parts to that. Number 1 was the mindset. We were caught in this trap of the medical system where there really is no solution. It's always going to lead to more drugs, insurance payments. It's all this whole net of catastrophe designed to keep you sick. And no fault of the doctors really, except if they're being lazy. There are some crooked ones, of course, and there's many crooked ones, but there are some good ones. And they're just stuck in this web. They're taught in school how to diagnose and how to treat a condition with a drug, and then they're paid to diagnose and then treat the condition with the drug. They're not taught cause. In other words, if somebody comes in with, like the condition I had, all this pneumonia, everything, it never occurred to the doctors that there was something causing that. It was bad luck, here's your drugs. And in my family, they're all geniuses. I had a pharmacist, I got a neurosurgeon in my family. We have lots of help, lots of good advice, but it was always drugs. And it was this bad mindset that there was nothing we could do. It was bad luck. So that was the first thing that we had to change. And we weren't looking for it necessarily. When my kidneys started to hurt, Now that was some pain I had that carried me to this chiropractor. And she abruptly changed our mindset. She said she took x-rays of my spine, and remember, we were there for the pain that was coming from my swelling up kidneys. She took x-rays of my spine, and she said, has anybody told you that his spine is causing his body to be weak? And of course, my family was like, no, we've never heard of such a thing. But she goes, look, you can't have a healthy body with a kinked up spine. It's not going to happen. And the analogy really made sense. Think of your spine as the water hose connecting your brain to your garden. So your body would be your garden, everything from your ears down to your toes, all of your organs, your hormones, testosterone, estrogen, progesterone, ladies, all of your neurotransmitters, things that help you feel good, like dopamine, your serotonin. You've got your lungs, your heart, your kidneys, your spleen, liver, bone marrow. All of that is part of your garden. Well, your brain is keeping all that working. If you turn your brain off, how fast does everything die? I could ask that question to 100 million doctors, and every one of them is going to say your body's going to die really quick if you turn your brain off. Right? It just can't live without your brain. There's no such thing as a brain transplant, and the same with your spine. This is fully in charge of keeping your body working. So Dr. Sandy told us, this is why his body's having trouble. His brain can't communicate to his body through his spine. Well, that was the first thing that made sense, and that is kind of common sense if you think about it, right? Your brain has to flow through your spine to carry all that power through your nervous system to make your body do what it's supposed to do. Well, my body was malfunctioning. She said, this is why it's malfunctioning, and instantly we had a shift in mindset. Oh, you mean there's hope that he can actually heal from this? And she said this so clear, and I love her for this. If you see this, Dr. Sandy, hello, and Dr. Bob, she says, look, his body is going to fix itself. And that clicked. That made so much sense. Our body is designed to heal. Like that story I shared at the very beginning of Aiden. I didn't fix his colon. I didn't make him poop. His body wanted to poop. His spine was stuck, so I did a little baby adjustment, and his spine started flowing, and his colon started working. It's that simple. She explained it that way, started adjusting me. Lo and behold, my lungs started working. My immune system started getting better. And I got off the table that first visit, and I could take a bigger breath. So every day for months after school, my parents would take me down, and I would get adjusted by Dr. Sandy. And that carried on for probably a year. I remember going all the time. And we didn't mind paying all that. I think back then it was like $100 a week, which in the 80s, it's not cheap, but I got my life back. My kidneys healed up. I never had to go back to the kidney doctor. I never went again for those stupid lung treatments. That you're not stupid if you're in the middle of that. I hated it. I didn't like doing it, and I didn't have to go back. And that was 40 years ago. I'm 53 now. Today, I don't get sick. If I do get a fever, it's like over in a few hours. I never went down with I haven't had the flu in probably since I was a teenager. Haven't had any of that medication since then. I haven't taken a prescription drug except for when I shattered a couple of bones. That hurt, and I went at the hospital. I was like, please give me something to kill this pain a little bit. But then that was one pill. I didn't take any more after that. No antibiotics, nothing for 3 or 4 decades now. That if you saw me as a baby, as a kid, what I just said to you wouldn't make sense. I was that sick, and people telling me I wasn't going to live to 40. So my mindset today is that you can heal, that you can change your life. If you're
playing with my grandchildren?
No.
But
if you don't change, what do you?
If I don't change, I would see myself sick.
Okay, describe that.
Struggling with different sicknesses, maybe I don't know, like.
I think I suffer with fatigue a lot.
Fatigue. Okay, so that would only get worse by the time you're 80.
Right.
See, here, and the reason I put those two guys on the spot, and you need to do this if you're watching this, is because we don't want to think that way. You should see the look on these two guys' faces. They did not want to answer that. In fact, Andy didn't. At first, he goes, Well, I want it to be like, I'm just saying, we don't want to look in the mirror. You have to do that. Take the shades off. You're in denial. You have to consider. I can tell you when I take people down this exercise and I say, what does it look like? What is your body doing? When you get up in the morning, what do you have to do? And they all say, oh, man, I'm going to be on a walker. I'm not going to be able to put my shoes on. I'm going to have to take my 10 pills. I'm not going to be able to think straight. This is where people go. And that's not even my opinion. That's statistics. I mean, the average Texan over 70 years old is taking 15 pills a day. You can imagine what that's doing to their brain and their body. So face the facts, all right? And let that scare you a little bit. I can tell you right now, these two guys are already making notes on their phone. Hey, I got to change this and this. So change your mindset, and then let's get into some hardcore details. Number one enemy to your body, and really there's maybe 5 things that are tied for being first place for death to your body. Like candy obviously is like horrifying, but processed carbs of any kind, cereal, packaged bread, bagels, without giving any brand names. You could probably think of something. If you're playing along at home, who can name the top 10 processed carbs out there? You guys want to shout 1 or 2 out while I go through these? Obviously donuts, the big ones.
Sweet bread.
So yes, sweet bread. How about processed fruit juices, alcohol? You go down the list of all these processed carbs. That is death to your cells. Like, you can't put those things in your body without killing off part of your cells. So coffee, processed coffee, like inorganic coffee, right? Organic coffee, your body can deal with that to some degree, but 4 cups of organic coffee is going to be too much. There's a high acidity content. So anything that falls outside of a protein and like a vegetable is probably going to fit into the carbohydrate category. The processed ones are the worst. Now, if you need to lose weight, like let's say you're obese, like you got 50 pounds, I got to get rid of this stuff. You're even going to have to limit the amount of fruit that you eat, and that has to be organic because of the sugar effect. So there's just a couple of rules to start with, right? If you don't cover those 2, then you're not going to cover the other rules, so it doesn't really matter. And everybody's addicted to sugar. I'm addicted to sugar. How many times have you heard that? Has anybody ever said that? You ever felt that way? Of course you are. Sugar's like a major dopamine trick in your body. It's the same receptors, very similar to what goes on when you snort cocaine. Hopefully you don't snort cocaine, but when people do snort cocaine, sugar is acting on those same type of receptors on a smaller level. That's why it seems so hard to quit. But then I go back and say, you know what? It's not hard to quit. You know what's hard? Getting up at 75 years old and you're on a walker all day and you can't have sex with your wife. That would be terrible, right? You can't put your shoes on. That's hard. Quitting carbs is not hard. And parents, get it away from your kids now. Dr. Brian, you mean you don't let Steele eat all that junk? That's terrible. You're being too much. And I said, that's your problem. I'm not going to let it be my daughter's problem. If she wants to choose that when she's 18 and 19 years old, that's fine. But I can tell you right now, you go talk to her. She'll tell you. We got this list of food dyes, and she goes, man, we got to watch out for this stuff. She don't want to. And she's 13. She's not putting that crap in her body. If she does have a cookie once in a great while, fine. But she's not going to be doing. Maybe I think the last time she had a cookie was probably a month ago, and then before that was 6 months ago. She just doesn't. She just knows better. She already has a really healthy mindset. So cut all that out. Just get rid of it. It shouldn't ever be around the house. And I remember eating Entenmann's. You remember that? These bakery things? Yeah. Man, I just said another brand. It was like icing and cinnamon rolls and oh my gosh, oatmeal cream pies. Oh man. We'd get home from school and me and my buddies just jam our hands into these boxes. Star Crunches, you remember those? Twinkies, all of that. That cannot be around the house because your kids are going to eat it and so will you. You shouldn't buy it. Don't do it. So that's like a short list of things to cut out. Now let's talk about what you can eat a lot of. Number one, most important thing, and you can go through all the diets right now if you want. There, just off the top of my head, there's a Mediterranean, the carnivore. You go back a little bit in time, and you've got the Atkins, all the way back to the weird stuff of seaweed and pretzels in the 80s or whatever they called that one. There's all these different diets, but the number one most important thing is to make sure it's clean. It needs to be organic, as organic as you could possibly get it. Like, go overboard where you're getting your meats to make sure it's organic. Now, in the meat category, hopefully you do eat meat. I'm a big proponent of meat. If you're a vegetarian, I still love you. But there are things that you get from meat that you do not get from veggies, no matter what anybody tells you. You need to be supplementing if you're a vegetarian, or at least eating like whole protein, like from hemp and that kind of thing. I mean, if you're a vegetarian, you probably know a lot of these rules. But for the meat eaters out there, it needs to be wild as you can, as organic as you can get it. There's a great restaurant up here. I know they won't mind if I mention them, Liberty Burger. They have a lot of clean meat. They have bison, they have lamb. So when we're out and about and we need to get some food while we're out and away, then we're not going to have time to prepare at home. We get Liberty Burger 2 or 3 times a week at least. I don't eat any of the bread, anything like that. We keep it clean. Now, sometimes, once in a while, I'll get the grilled cheese because that thing is delicious. But if you look at what we put in our body, it's 90 to 95% no processed carbs whatsoever, real clean meat, and then clean veggies, so organic veggies. And I like to say, it kind of depends on your taste, but sauteing your veggies real lightly, putting some sea salt, coconut oil, those are some good suggestions. So if you just want to say, what can I eat? Let's just start with clean organic meats and colorful, lightly sauteed vegetables. If it doesn't fit into those 2 categories, don't put it in your body. And if you have 50 to 60 pounds to lose, you're going to start losing weight. All right? All this other junk, all right? Clean, green, red, yellow veggies, wild organic meats, all the other bread, crackers, pasta, soda, rice. Yes, I said rice. All that stuff is going to stop your weight loss in its tracks through your hormones. And I know it may seem difficult. Just keep reminding yourself, hey, I don't want to be in a wheelchair when I'm 70. This, what I just laid out, that simple eating plan, and we've got handouts here for you at the office if you need more detail, if you want like a longer food list. I've got all this stuff here at the office. I've got many resources. But it's got to start with your mindset. What do you want life to be like tomorrow, 5 years from now, 30 years from now? It starts today. What you do right now with your body affects you over the next minute, the days, the weeks to come. You can change. You can make everything better. I did this with my parents. I said, look, do you want to see steel grow and develop? And God rest their souls, they both died at 77 years old, but they were both dying at 50. When I got a hold of them in their mid-50s and early 60s, I even told them, I said, look, when Misha and I have a baby, you're not going to be around to play with her. And they both got to know her. They both got to love her, spend a lot of time with her. And I could tell you that was the most gratifying thing I've ever done in my life, is to get into my parents' face and tell them they are not going to see their grandkids grow up. And they changed. They cut out so much crap, lost all this weight, all these medications, and they thrived for the next 15 to 20 years. So we had 15 to 20 great, healthy years with them, and I'm so proud of them. You can do this. You can change it. Just motivate yourself. If you need help with your spine, obviously that changed everything for me. It regulates your metabolism. Your nerves actually control your hormones. That has to be flowing. I've had people come in, just get adjusted, not even change what they're eating, and they start losing weight that first week because their body's just more efficient. Once you start taking care of your spine, you need to keep taking care of it on the daily. Like if you look at the 3 of us, we're sitting down. This is crunching our spine. Gravity is doing its thing and smashing and compressing our spinal cord. Well, if you smash and compress and twist up your hose to your garden's not going to get the water it needs, and it's going to start having trouble. So every day I do things for my spine, whether it's core work, these little wobble exercises that you see people doing in the office. I get adjusted 3 or 4 times a week just to keep everything flowing. And that is a major part of why my garden is doing so well, why I just don't get sick, why my lungs healed up, why my kidneys healed up. I still have my kidneys. If you want to be well, you need to be taking care of your spine regularly, not just when you hurt or not just when your baby's constipated. We need to be taking care of it regularly. It's like brushing your teeth. I mean, you take care of your teeth regularly. You love your family regularly. This needs to be added into the equation if you want your life to truly thrive. So give us a call. We're in the North Dallas area. I have people driving in from Midland, from Oklahoma, from Waco. I mean, you name it. They'll come here and I'll explain everything. I'll get your spine x-rayed. I'll sit you down and explain to you where the kinks are what we call subluxations. that's interfering with your life, and we'll get to work on them, show you how to stretch those out, keep your spine flowing, make those small changes in what you're eating, and watch the miracle unfold right in front of you. You can find us online, drhooten.com. We're here to help you and everybody that you know. Remember, drugs are bad, God is great, and so are you.